Imagine waking up tomorrow and not remembering where you put your keys. Not once, Tess, 3 times in the same morning. You brush it off. Everybody does that.
But what if that small fog isn't in your brain at all? What if the real problem is happening several feet lower about, right now, as you watch this?
Your gut and your brain are in constant communication through a pathway your doctor almost never discusses during a 15-minute appointment.
Today I'm going to show you 5 ways that connection may already be affecting your memory, ranked from the least recognized to the most critical.
Most people think of the gut as a digestive tube. Nutrients in, waste out. That's about 5% of what your gut actually does in your body.
There is a direct highway between your gut and your brain. Scientists call it the gut-brain axis. It runs both ways.
Your gut houses 500 million nerve cells. It produces 90% of your body's serotonin. And after 60, this system becomes increasingly fragile.
The problem is not that you did something obviously wrong. The problem is that the damage to this cable is silent, slow, and cumulative over years.
Think of it like a fiber optic cable buried underground. You don't see it, you don't feel it tinned, but it is carrying signals that control how clearly you think.
A transcription features a calm, warm, authoritative female voice with no accent, delivering their...
When patients come to me with memory complaints, the first question I ask is not about their brain, it's about their gut. And that changes everything.
None of this causes acute pain. None of this sends you to the emergency room. It just quietly dims the sharpness of your thinking, week by week, year by year.
Gut bacteria diversity drops, the intestinal lining thins, neurotransmitter production slows, and the communication line to the brain becomes increasingly unreliable. What I'll show you are 5 specific pathways. Each one has a name, a mechanism, and the critically about it, something practical you can do about it starting this week.
I'll also tell you about a patient. I'll call her Margaret. She was 6 to 9, a retired nurse. Her memory declined.
Number 1, the one that surprises patients most, involves not what you eat, Pav, but a specific bacterial byproduct your gut makes that feeds your brain cells. By the end of this video, you'll understand this connection at a level most physicians were never taught, and you'll know exactly what questions to ask your own doctor.
Let's start with number 5. It's the one hiding in plain sight, affecting mood, energy, and mental clarity. Most people mistake it for depression.
Connection number 5, your gut's role in serotonin production and what happens when that production drops while your doctor is looking at your brain. Here's something that stops patients cold when I explain it. Roughly 90% of your body's serotonin is not produced in your brain. It's produced in your gut.
Serotonin is not just a mood molecule. It regulates memory consolidation, attention focus, and the speed at which your brain forms new connections between thoughts. When the gut bacteria responsible for triggering serotonin production are disrupted, the brain gets less of this signal.
You don't feel this as a sudden change. You feel it as a vague fog. A sentence that starts clearly and
Doctors prescribe SSRIs to raise serotonin in the brain, but if the gut isn't producing it, you're treating a fire at one end while ignoring the water supply.
Fermented foods, your yogurt, kefir, sauerkraut, kimchi, has increased populations of those bacteria. Not a supplement,
I'm not saying fermented food cures memory loss. I'm saying restore the bacteria that make the signal and the signal starts flowing again. Step 1, simple step. Connection number 4 is less known but more directly physical. It involves a nerve most people have never heard of 10. And what happens when that nerve goes quiet?
The vagus nerve. It is the longest nerve in the body, running from your brainstem all the way down through your chest and into the lining of your digestive tract.
Think of the vagus nerve as the main telephone line between headquarters and the field. Roughly 1/8% of its signal.
Your gut is not listening to your brain. Your brain is mostly listening to your gut. That reversal changes everything about how we should think about cognitive health.
When gut inflammation is present, even low-grade, chronic inflammation you don't feel as pain, it disrupts vagal signaling. And the culprit is often not dramatic. It's low-level gut dysbiosis, a shift in your bacterial balance.
Research in gastroenterology suggests this reduced vagal tone is associated with slower cognitive processing and difficulty forming clear short-term memories.
Reducing ultra-processed food reduces gut inflammation. That, in turn, reduces vagal interference.
I tell patients, 3 minutes of slow belly breathing after meals. It sounds too simple to matter. The research says otherwise. Your vagus nerve is listening.
When the gut lining is chronically irritated, it produces a class of molecules called pro-inflammatory cytokines.
Connection number 3 is where we start moving from common to critical. This one involves inflammation call and a pathway that most neurologists are not yet routinely testing.
They enter the bloodstream,
cross into the brain and activate the brain's own immune cells, called microglia.
What does this look like in real life? Difficulty finding words mid-sentence, walking into a room and completely forgetting why, losing the thread of a conversation.
Chronic microglial activation is one of the hallmarks consistently found in studies of cognitive decline. The gut-generated inflammation may be helping to trigger it. These symptoms get attributed to age, they get dismissed, and the gut, the source of the inflammatory signal, never gets examined at all. That is the real problem.
The primary triggers of this gut inflammation in patients over 60? Ultra-processed foods, excess refined sugar, omega-3 fatty acids from fish, walnuts, flaxseed, reduce gut and brain inflammation simultaneously.
I'm not promising reversal. I'm saying address the source of the fire and the smoke in the brain may begin to clear. That's a fundamentally different approach. But here's what most doctors never tell their patients. Gut inflammation is not permanent. It responds, sometimes within weeks of dietary and lifestyle change. At this point, I want to pause and tell you about Margaret Pan, the patient I mentioned at the start, because her story brings all of this out of theory and into real life.
Let me tell you about a patient. I'll call her Margaret. She was 6'9", a retired nurse from Ohio. 30 years of shift work, then a quiet retirement.
For about 2 years, she had been noticing changes, forgetting conversations she had just had, losing track of dates. Her neurologist ran standard cognitive testing. Her score was at the lower edge of normal. The verdict? Age-related cognitive.
Her gut microbiome testing showed severely reduced diversity, elevated inflammatory markers, significant reductions.
We addressed her gut. Dietary changes, reduced ultra-processed food, specific probiotic strains. When she came to me with digestive complaints, chronic bloating, irregular bowel habits, low-grade fatigue, I started asking her about her cognitive symptoms as well. I tell this story not to promise that outcome for everyone. I tell it because nobody had asked about her gut, and that question changed her life.
Margaret's case is an illustrative scenario. If you have cognitive concerns, please consult a qualified neurologist and your primary care physician directly.
Now we move to connection number 2. This one has a name you may have heard to Ben, but the mechanism behind it is almost certainly not what you've been told. Her own words, at a follow-up, I feel like someone turned a light back on. Retesting showed meaningful improvement across every cognitive measure we tracked.
Your gut lining is a barrier, a single cell thick in places. Its job, let nutrients through. Bacterial fragments and undigested particles enter the bloodstream. The immune system launches a response.
Intestinal permeability. What many people refer to as leaky gut is medically known as increased intestinal permeability and its connection to the brain is direct.
What drives intestinal permeability? Chronic NSAIDs use. Alcohol, even in moderate amounts.
These are substances in everyday products. You've been consuming them. The connection to brain health has not been part of the label. It should have been a conversation. Growing research in gastroenterology suggests that neuroinflammation triggered this way may contribute to the pattern of changes we see in cognitive aging and decline.
Butyrate, produced when you eat fiber, directly feeds and repairs gut lining cells. Zinc, found in pumpkin seeds and lentils, supports tight junction integrity as well.
But here's what most doctors never tell their patients. The gut lining regenerates. It is one of the most rapidly renewing tissues in the human body. It can be restored. Discuss any concerns about NSAID use with your physician before making changes. But adding fiber and reducing processed food, that you can begin evaluating today. And now we arrive at connection number 1, the one that changes the frame entirely, the one I wish every single physician had been taught alongside their neurology training.
Your brain accounts for 2% of your body weight, but it consumes 20% of your total energy. That energy has to come from somewhere consistently.
Connection number 1 is not about a single molecule or a single nerve pathway. It is about a class of compounds your gut makes that your brain cannot live without.
When your gut bacteria ferment dietary fiber, they produce short-chain fatty acids. Butyrate, acetate, propionate. Butyrate in particular crosses the blood-brain barrier. It provides energy for neurons. It reduces neuroinflammation. It supports the formation of new brain connections.
Studies in gastroenterology suggest that reduced gut microbiome diversity correlates with reduced short-chain fatty acid production (HAB), and that this affects cognitive function. If your gut bacteria are depleted through poor diet, antibiotics, aging, stress, your brain
What does low butyrate look like in daily experience? Slower processing, difficulty concentrating for IDS.
Patients describe this and get told, it's your age, it's your thyroid, it's stress. The gut was producing less brain fuel. Nobody thought to look there. Nobody asked.
Antibiotics, even a single course, can reduce short-chain fatty acid percent.
Over a lifetime of antibiotic courses, processed food, low-fiber diets, and chronic stress,
The bacteria that produce butyrate are called Fecalium prausnitzii and Rosaburia species. Their primary food source?
Cooked and cooled potatoes, green bananas, legumes, oats, Jerusalem artichoke. These are resistant starches that specifically feed butyrate-producing bacteria.
no prescription required, no specialist referral needed to start. A conversation about fiber diversity is available to everyone had, but almost nobody is having it.
Depleted serotonin production, disrupted vagal signaling, gut-driven neuroinflammation, intestinal.
When you understand that, you stop chasing individual symptoms with individual treatments. You ask a different question entirely. What does my gut need in order to support my brain? That shift high from symptom management to root cause support to is the entire premise of gut-brain medicine, and it is available to you, starting with your next meal. Here's the deeper truth behind all 5 connections. They are not 5 separate problems. They are 5 expressions of one single failure, a gut that cannot support the brain. So let me give you something concrete to walk away with, not a general recommendation. 3 specific actions that address this system together, starting this week. Step 1, diversify your fiber sources. The goal is not more fiber, it is more variety.
An apple, a handful of walnuts, some lentils, a spoonful of sauerkraut, that's already 4. You are not starting from 0. You are expanding what you already do.
Step 2, identify and reduce your top 3 sources of ultra-processed food. Not all of them, not a perfect diet overnight. Replacing those 3 items reduces gut inflammation, improves intestinal barrier function, and starts restoring the bacterial populations your brain depends on. 3 items.
After your main meal, before you sleep, sitting comfortably. It costs nothing, it requires no equipment.
Step 3, activate your vagus nerve daily. 3 to 5 minutes of slow, deep breathing, the 4 seconds in, 6 seconds out. 3 steps, more fiber variety, fewer ultra-processed foods, daily vagal breathing, not a guaranteed. The 15-minute appointment was not designed to uncover root causes. It was designed for acute problems, chronic systemic issues like gut. Your gut is not just a digestive organ, it is the headquarters of your health. And your brain, its most important downstream system, is waiting for your gut to recover. Every meal is a message to your microbiome. Every choice you make in the next 30 days sends a signal up that gut-brain axis. My goal today was not to frighten you, it was to give you a map. Fear without direction is paralysis. Fear with a map becomes one of the most powerful forces for change there is. And if you have someone in your life, of a spouse, a parent, a sibling app, who has been told their memory changes are just aging, please send them this video. They deserve to know. Every week, I cover one more piece of this system that most appointments don't have time for. Subscribe if you want to keep building this understanding, one video at a time. Today, we covered 5 connections: serotonin production, vagal nerve tone, gut inflammation, and take care of your gut, take care of your brain, and take care of yourself. I'll see you in the next one. Next time, we'll look at the 5 specific foods most commonly found in American kitchens that research suggests are actively disrupting this system.
There are 14 different serotonin receptors in the gut lining alone. Each one plays a role in gut motility,
It is not a coincidence. It is not psychosomatic in the dismissive sense. It is a real bidirectional biochemistry.
The vagus nerve also regulates the gut immune response. Low vagal tone means the gut inflammatory response becomes louder.
When patients report that their mood and their gut act up at the same time, anxiety with a churning stomach or depression with constipation high, this is the system talking. In addition to breathing, singing and humming engage the vagus nerve through throat vibration. A few minutes of humming after meals is not absurd, it is physiology.
The specific cytokine most consistently associated with gut-driven neuroinflammation is interleukin-6.
Reduced vagal tone is not a rare condition in older adults. Studies suggest it is common and often goes entirely undetected.
Polyphenols, found in berries, dark leafy greens, green tea, dark chocolate, directly reduce gut-sourced inflammation.
Elevated inflammatory markers are common in adults over 60, but their gut origin is almost never the first question asked. It is often never asked at all.
The tight junctions between gut lining cells are like the mortar between bricks. When they weaken, gaps open.
Frozen blueberries are nutritionally equivalent to fresh and significantly less expensive. A quarter cup of blueberries daily is enough to produce measurable polyphenol intake.
Chronic stress elevates cortisol. Cortisol directly impairs the proteins that maintain tight junction integrity. The gut stress surfeits. Glutamine, an amino acid abundant in bone broth and eggs, supports gut lining integrity directly. It is the primary fuel. Short-chain fatty acids also regulate the blood-brain barrier. That barrier is the final gateway controlling what enters the brain and what stays out. Butyrate strengthens it.
Most adults over 60 have experienced years of accumulated stress, financial, relational, medical. A weakened blood-brain barrier and increased intestinal permeability often occur together. The same gut dysfunction that What that means practically, the inflammatory particles that enter through a permeable gut now have an easier path reaching entering brain tissue. Diversifying fiber sources is step one, but reducing the antibiotics you take unnecessarily to be present. One question I get, how do I actually track 30 plant foods a week? Simple method me, keep a running list on your phone. Not calories, not macros. You will be surprised how quickly the number grows once you are paying attention. Herbs count, spices count, a sprinkle of mixed seeds counts. How do you identify ultra-processed food? Simple rule, if it has more than 5 ingredients and you don't recognize 3 of them, it belongs in the ultra-processed category. You don't have to eliminate everything. You are replacing the 3 you eat most often, one at a time if needed. Sustained change over weeks beats perfect change that lasts 2 days. Ding. For the vagal breathing, sit comfortably after a meal. Close your eyes if you can. Inhale slowly for 4 counts. 3 minutes. That is less time than most people spend reading news headlines after dinner. But those 3 minutes are in direct conversation with your gut and your brain. Here is what I want you to hold on to after this video. Memory is not fixed. Cognitive health is not purely genetic fate. Tell me in the comments, which of the 5 connections surprised you most today? Was it the serotonin, the vagus nerve, the brain fuel? I want to know where the gap was. And after this video, before you do anything else, Paul, pick one of the 3 protocol steps. Just one. Write it down. Commit to starting it in the next 24 hours. If this content gave you something useful today, the single best way to say thank you is to share it with one person who needs it. One person in your life. That's all it takes. One of them is something most doctors would recommend to you without hesitation. I'll explain exactly why the research paints a more complicated picture for gut health. Quick recap before we close. 5 gut-brain connections: serotonin production, vagal tone, cytokine-driven nerve. In the next video, we're going to go deeper. 5 specific gut-disrupting foods that most seniors eat daily, believing they are healthy. Number 3 will genuinely surprise you. 3 actions to start. Diversify fiber sources, reduce your top 3 ultra-processed foods, and breathe slowly for 3 minutes after meals. The fog you've been attributing to age may have a very different address. It may be starting in your gut, where nobody ever thought to look. Now you know to look there. You now understand this connection at a level many physicians were never formally taught. That is not an exaggeration. Use that knowledge to ask better questions at your next appointment. Advocate for the tests, the conversation, the referral. Your gut is part of the picture. Insist on it. Thank you for being here and for taking your health seriously. Take care of your gut. Take care of your brain. I'll see you in the next one.